So welcome. Many of you have probably seen me before talking about radon, and in my life I have two hats. One is as an epidemiologist and the other is as a radon researcher. And what COVID-19 has done for me is actually put both of those hats on top of one head. So now I get to do a little bit of both all the time. So not only do I work on radon, I'm also a professor at SFU, and then I've been seconded to work at the BC Centre for Disease Control, doing sort of what we're doing right now, which is answering questions for people about the virus to the best of our ability. So Pam, do you want to go to the next? I'll just say next. How does that sound? So just a disclaimer for everybody that our society's understanding of COVID-19 really is changing all the time. And never in the history of science has so many people been working on the same problem all at once, really quickly, with the shared common goal of trying to figure out what this virus is, what it does, and how we're going to move forward, and whether or not we can get a vaccine. Like, all those questions are really, it's really an incredible time in the scientific world to see so many brilliant people working together to try and find a solution. So just to let all of you know that people are working flat out to try and fix what's going on, and recognizing that this is not a simple fix, and this is probably going to be with us for a fair amount of time going forward. So patience is necessary, and that right now a lot of things really remain unknown and uncertain, and that's not unique to this particular virus. It's usually like this with when we see a new or novel virus. It just happens to be that this virus is incredibly infectious and we're all involved this time. So the idea that we don't have the answer yet is not novel. It's normal. It just, we're all having to experience it all at once. Okay, next. So let's just talk quickly about what a coronavirus is, because we keep talking about the coronavirus, but there are actually 8 different coronaviruses that people can get, and animals and birds have lots of different kinds of coronaviruses. And the coronavirus is very different from the virus that causes influenza or the flu, and it's very different from the norovirus, which you may have heard of if you've been unfortunately on a cruise and you've had an outbreak of norovirus. That's a different virus family as well. So a coronavirus is part of the Coronaviridae family, and it has 2 to 3 very close relatives in that family. One is the first SARS that we called that virus just SARS, and that happened in 2003. There's been a recent outbreak of MERS, which is a camel-related coronavirus. They usually have an animal host. And then there's something called 229E, which we call the common cold. So the coronavirus has a lot more in common with the common cold than it does with influenza, because it's the cold is part of our family, this virus's family, and not part of the influenza family. So I know that's a bit confusing, but the comparisons between coronavirus and the flu are no longer very helpful, because we know that the coronavirus is a family in and of itself. So it's called a coronavirus just because I'm sure you've seen these pictures now of this ball with the things on the outside of it. The virion is what that one particle is called. It's covered by a halo of spike proteins. Those are what's used by the virus to attach to a host, and they look like a crown. So the people that were naming these, when they looked at them under a microscope to begin with, called them coronaviruses because of this unique aspect of them. Okay, next. So we call it COVID-19. Which is a derivative of the term coronavirus disease from 2019. Historically, we have used both the place where the virus first emerged or the animal host. So you might have heard, the Spanish flu pandemic or the swine flu. But over time, we know that those names aren't helpful because they tend to stigmatize either a country or a creature. When the swine flu hit, pork sales completely plummeted. And it's not really fair because it wasn't really the pig's fault, and you really didn't you didn't contract that virus from eating pork. So there's a bunch of moves to make nomenclature more clear and less stigmatizing. So that's why we call it COVID-19, but that's just the disease. It's not the virus. So the virus that causes the disease is called SARS-CoV-2. And if you're wondering about that, if you imagine there's HIV is the disease, AIDS is a disease, and HIV is the virus. So we already have in our world a way of differentiating between a virus and the disease it causes. So SARS-CoV-2 is the virus, and COVID-19 is the disease. So SARS really stands for severe acute respiratory syndrome, and that's just a reflection of the fact that this is very much a respiratory disease. It's a disease of the upper airway and the lungs, and then deep into the lungs. So it's not, a norovirus tends to have other body parts that are involved. This is a respiratory disease. So what's interesting about the virus is it's surrounded by a fatty lipid membrane. And that's, I don't know if I can use that on my screen, but that's the thing, just below those spike proteins, there's a fatty lipid membrane. And those outer spikes allow the virus to very effectively attach to the ACE2 receptor cells. I won't get too much into that, but those are mostly found in the lungs and the trachea, and in some cases in the lower GI tract. But what we're looking at the moment predominantly is the virus that comes in through airways and passages. Next. So the way that this works is the virus comes along and it attaches out to the outer part of your cells. Once it enters into the cell, it's called an RNA virus. I'm sure most of you are familiar with DNA, but DNA has 2 RNA parts. So this is an RNA virus, meaning that it has half the DNA. It comes along, essentially hijacks your cell and tells it to make more of itself. And so once the virus comes into a cell, your cell gets taken over and it becomes a factory for making more viruses. And then those viruses are released back out into the world. And the whole goal of the virus infecting you is for it to get to other people. And that's its primary goal. It doesn't necessarily want to kill you. It wants to make more of itself. So a highly successful virus is one that actually doesn't kill its host off, but it manages to get into you and then infect a whole bunch of other people. And so far, this virus is doing a very good job of transmitting from person to person. Okay. So what do we know about the origins of COVID-19 at the moment? So most coronaviruses have 1 to 2 animal hosts, and this virus does predominantly seem to come from the same kind of viruses that they find in bats. And the first SARS outbreak had, so that's SARS-CoV-1, came what they believe the intermediate host was a kind of cat called a civet cat. And in this case, at the moment, the hypothesis is it's either just a bat or a bat and a pangolin, which is a very small creature that's found mostly in Asia. And right now, the idea that it was a consumption through eating bats has really been dismissed. It's more likely that people inhaled either the guano from bats or there was some respiratory transfer. Interestingly, MERS is also transferred from camels to people through respiratory droplets. Camels can be very spitty kind of creatures. And so the idea that, again, this came from bat soup has been very much dismissed, but the idea that there might have been people in and around places where there was volatilized bat excrement, which sounds really gross, but is possible. If you're in caves, for example, that's always a risk if you go caving that you can inhale some bat guano. And we know a lot about the fact that bat guano over history has not been very good for people. I'm sure you've heard the term batshit crazy. And part of that is because we know that bats transmit things that actually can be bad for people, and we need to be careful in and around bats. So forensic analysis, interestingly, have also shown that this idea that the outbreak just had to happen in China in a wet market isn't true, that there have been circulating cases of the virus that were found early as November of 2019. So it's possible that the Chinese wet market was a super spreader event. So there was probably 1 or 2 people there who were already sick. And because it's a very crowded place, we see a lot of transmission. But there is very clear evidence that where people were sick with this virus prior to that one event. And there's stored samples of all sorts of things all over the world. People take sputum and feces samples and adipose tissue and all sorts of things. So we have banks of samples that just over time, they'll go back and look and see if there's evidence of this virus in many body fluids that were collected for other purposes. So we'll know more later. So far, there is no patient zero that's been found. So no 1 or 2 people that we can point to that were the major places where this actually was an outbreak. But that tends to be what epidemiologists do, is they try to find where this originally came from. And that's for prevention for a next outbreak. So what do we know about transmission, which is really important for us when we're all going back to work? The primary transmission at this moment in time is known to be through contact with droplets. And droplets are created when we cough or we sneeze, but also when we talk and we laugh and we sing, and then when we share a meal. So many of you may have seen YouTube videos of, they put tracer dyes in people eating meals, and then just exactly what happens when you share a meal. So there's a lot of chewing, and other things can also extract droplets and spread them across the room, especially if you're talking or laughing in a table setting and facing another person. So there's been a really interesting article that was published on a Chinese outbreak. So that A1 in that picture is the index patient who was carrying the virus, and that person managed to infect all of those other people in the restaurant. Now, this was an air-conditioned indoor restaurant, so no open windows, and they were able to trace, nobody was ill at that point in time. That was the only ill person in the room. And so you can see most of the people that person was having, eating with, but also the people behind them also got sick, and then they believe the airflow may have transferred the virus to the other end of the room, and that's why those 2 people got ill too, although those people also may have got up and simply walked by the person on their way to another amenity at the restaurant. So we're starting, because the evidence is finally here, we're starting to be able to dig in and see how the virus moved through different places and how contact occurred. And oh yes, just to mention that that person 1 was not actually particularly sick. It's what we call pre-symptomatic. So they might have had minor to no symptoms. Okay, Pam, next slide. So the issue of singing has really become prevalent because we've had, once again, an unfortunate opportunity to understand what happens when people are together in one space. So this is an outbreak that happened in Mount Vernon. It was the Skagit Valley Choir. And one person came to this practice who was a little bit symptomatic. We already knew by this point in time, and Washington State had already been taking safeguards to try and keep people apart. So this was a group that was trying to socially distance. They sang together in a room for 2.5 hours. They shared cookies and tea, but they were trying to be away from each other. They then stacked the chairs together, so a bit of exercise and probably closer contact. And the symptoms with the people in the choir showed up between 1 to 12 days later. And unfortunately, 2 people in that choir have died, and almost everybody, so 87% of people developed or tested positive for COVID-19. They had varying stages of illness, and we're still waiting to see what the outcomes are. Many of these people are actually still sick. So that's another aspect of this virus that's somewhat troubling both for the healthcare profession and people who get it, is that when you get it, you can get it for a very long time. And so it can be 4 and 5 weeks. Some people are hospitalized. So this is still an ongoing investigation because we haven't seen the end of the disease for some of the people that still have it. The average age of the people was between late 50s to early 70s in this choir. Next. Another really interesting case of transmission happened very early in the outbreak. A woman flew from Asia to Germany as part of an auto parts, a car parts company. And she had a very mild symptom. In fact, they thought she was unsymptomatic, but she did have a headache. And she took a pain pill, but she'd visited her family from Wuhan just before. Then she flew to Germany. She attended a business meeting and then went to the lunchroom and sat down and ate lunch and borrowed a salt shaker from another employee. She asked to pass the salt, basically. That person passed her the salt. She passed it back. That person got sick. So this points to the importance of what we call fomite transmission, or the ability of the virus to transfer between objects. So whether or not they looked at each other when they were passing the salt or how close they came, we don't know, but we do know that the salt shaker was a common object between a woman with a headache and a person who passed her the salt. So I hope you're getting the general idea that this is an incredibly contagious virus that appears to need to have at least some kind of human contact or human contact to object in order to be transmitted. Okay, next. If people would like to see citations for any of these two, these are all published peer-reviewed papers, so I'm happy to pass those along. So far we've talked about droplet transmission and fomites, which is objects. I'll talk a bit more about that. But there's also this issue of aerosols that you may have heard of. And why we're really interested in aerosols is because they're very small particles and they can stay suspended in the air for a long time. So someone could be sick, leave the room, and then you'd show up a couple hours later. Is the virus still there? So there was a few studies that came out to begin with that showed that aerosol transmission was possible, but that was under laboratory or controlled settings. And that, and particularly when they intubate people to help them towards, if they're getting a severe disease, there's a way of actually putting in a tube, but that generates aerosols in and of itself. So that's pretty risky procedure, but hospitals have infection control protocols. One of the other places that we do generate aerosols though is bathrooms. And so the virus has been found in feces, and we do know that toilet plumes, if the lid is not down, can generate aerosols. This is just basic hygiene research that shows this. So there's a big question about whether or not bathrooms, if a person is sick, can be a source of infection. And to date, we don't have clear answers for this yet, and that's part of why they're just really recommending that people who are sick have their own bathroom, or that if you have someone sick in your house, that you regularly maintain high hygiene standards if every time that person uses a shared bathroom. And there's also questions at the moment around hand dryers. Some of the hand dryers tend to volatilize particles as well. So there's just a lot more research going on bathrooms at this moment in time, particularly around this aerosolized risk. Okay, next. This is just a visual of how the fecal and urine feces, and so the virus has been found in urine as well at the moment. So, but not nearly as much as in feces. The interesting thing about the feces is that it's up to 5 weeks they've found virus in people's feces, although whether or not there's enough of it to actually create a sickness, so what's called a viable virus, that has not been tested. All they've tested for is the presence of genetic information in feces. And in fact, in the States, they've started a monitoring program looking at the virus in feces in public sewer systems so that they can isolate outbreaks. And that's Washington State has started some tracking of that at the moment. So yeah, this issue around toilet plumes and how important it is actually just to put the lid down when you flush the toilet is a simple step to help prevent the transmission of anything, not just COVID, but other things as well in and around your bathroom. And just to note that SARS did have this major fecal transmission outbreak. So that's what I'm going to talk about next. It's sort of a famous part of the first SARS-1 outbreak in 2003. So many of you who know a bit about plumbing will probably be familiar with this issue. So during the SARS-CoV-1 outbreak, one person was infected and went to an apartment building. It's a very large apartment building that had multiple towers. And there were dry U-bend toilet pipes. And what this did, the ventilation was not right in this building. And again, there's probably ventilation experts that know more about this than me, but essentially the U-traps vented into the light well. And what that did was it allowed aerosolized feces to get into the system, and it infected 321. So one person with diarrhea infected 321 people in this building and the buildings around it, and 42 people died. So 4 towers ended up being impacted by this. So the virus went up through this one tower and then was able to move between 3 other towers. They're very tightly packed together. And this is a major advance in our understanding of viral transmission. So there's concern at the moment that this SARS-CoV-2 may also have similar manifestations. Now, the plumbing in this building was recognized to be substandard and that this would not occur with proper plumbing. But how many buildings have substandard plumbing is probably something you guys know better than I do. Okay. So I referred previously to what we call fomite transmission. So fomite is just a fancy word for a contaminated surface like a salt shaker. And what can happen with this is both the direct transference so you cough on something like a pen, which is something I think we probably all need to be thinking about. Don't share pens. You cough or you touch a pen, you hand it to somebody else, they touch that, they now have your droplets on their hands, and then they touch their face. That's one kind of fomite. That's direct. There's also indirect in that somebody coughs, the fomite settles on a surface, and then it can resuspend and come back into the air. So because this is so new, we haven't done a lot of research on fomites, particularly for SARS-CoV-2. We do know that this is particularly an issue for other very persistent viruses like norovirus. So this is part of why cruise ships become such a problem, is because the virus can live a very long time and remain in people's cabins, and they need to be sterilized very thoroughly when there's a norovirus outbreak before another person can come in, because those cruise ships, a lot of people can get very sick. And that's where we know really the most about fomite transmission. Hepatitis is another virus that's also transmitted potentially via fomite, indirect and direct fomites. And that's why people who have hepatitis in part shouldn't work in food facilities, because they can transfer. So in the next slide, sorry, Pam, next. This is some of the work that I've been doing for the BC CDC, is collating how long the virus actually lives on certain surfaces, because that's, of course, very important for this fomite transmission pathway. Recognizing that, again, it's more about droplets that we know at the moment, but going forward, this other direct and indirect surface contamination might be a problem too. So what the evidence, and this is evidence on SARS-CoV-2, so this is specifically the virus we're dealing with right now. It lives very shortly on tissues and paper and cardboard. So up to 24 hours, the virus remains present on these surfaces. And just a moment to talk about, so there's no such thing as a live virus. So there's either the presence or the absence of virus, but unlike a bacteria, a virus is not alive in our understanding of it, because it's only half of a thing. It's got only a bit of RNA. So their ability to persist on substances or surfaces is actually much higher than bacteria, because they don't need a lot of the other things that organisms need to stay alive. So they tend to be quite persistent. So stainless steel, plastic, and glass, in the studies that have been done, they found the presence of the virus for up to 4 days. And in the case of plastic, it went as long as the studies have gone on for. So there's still, when they look under microscopes, they could still see the presence of the virus after up to 4 days. So people ask about, well, what happens when I go to the grocery store, and what should I be doing with more plastic? And we're really recommending that people wash their hands, but after they handle most things, for this particular reason, is that you might still be getting virus off of surfaces. So if you're going to eat, or you're using those plastic tubs that your vegetables come in, that hand safety, your hand hygiene in the kitchen is also really important, not for the food itself, but because then you're going to touch your face afterwards. So fascinatingly though, copper and aluminum have what we call virucidal properties. So the virus only lives for about 4 hours on these kind of metals, which might have some advantages in the future for biofilms that could be used, or sprays that could help reduce viral load on surfaces if we use these kinds of substances. And then wood and cloth are up to 2 days. And if you go to a clothing store now, you might see signs that say that once you try something on, they're going to put it in the back for a day. And that's because they want to reduce the viability of the virus on that surface. And this is a ever expanding area, but these are accumulation of at least 3 studies at this point in time that have been done. Okay, next, Pam. So people often want to talk about what the symptoms are, and what our original understanding of the symptoms were has changed a little bit. So now the 3 primary symptoms, they all don't have to happen at once either. You might just have a cough, or just have muscle aches, or just have a fever. So these are really the primary symptoms. And if you have these, you're often eligible to go and have a test. These are in BC. If you call in, we have a place where you can call in, explain what the symptoms are, and then they'll direct you to testing. But it's not just those. We've learned over the time that this is a really interesting virus, and it manifests itself differently depending on how old you are and your underlying health status and just maybe who you are. So headaches, this really interesting loss of smell, which is quite fascinating and took researchers by surprise. Some people get, about 10 to 15% of people get diarrhea and nausea or a loss of appetite. Children are developing something called COVID toes, which is a red rash that occurs on the feet. Some people have runny noses, but not everybody does. Same with a sore throat, and then chills. And that also ties in with the sort of fatigue, muscle ache, and fever part. There are some other manifestations of this virus that are quite troubling, and one being stroke. The sudden people who can have strokes and then have died, and then they realize they're COVID positive. So this is a big area of research at the moment, is why people might suddenly, and these are people between 33 and about 55. So they've seen a sudden spike in the number of stroke cases in these populations, and where they can test for COVID afterwards. Not everybody can do that, but they have found that many of these people were infected. Some cardiac involvement has been seen, and then rashes. But essentially the virus goes through and it pretty much attacks most organ systems that it can. But these are the symptoms that you would initially present with. And as how severe your disease is, we don't really know why. The older you are, it does seem more likely to have a more severe disease, but there are still people in their 30s and 40s that have a very hard time and are sick for a very long time. And to this date, they still don't know why. Next. You may have also heard about what's known as asymptomatic or pre-symptomatic transmission. And this is particularly troubling because it means that people are transmitting the virus before they even know that they're sick. And that is, not common amongst most other illnesses. Usually you're sick before you're transmitting a virus. And this might be why in certain places the viruses got going, because people didn't realize they were sick, didn't necessarily stay home. And that's why social distancing is working so well. So they believe that I just read a recent study yesterday, 60% of people may have been infected by asymptomatic or pre-symptomatic people. So pre-symptomatic means you're going to get sick, you're going to start to get symptoms, but asymptomatic means that you don't have any symptoms at all. And different countries have seen different rates of this, but that's a significant amount of transmission from people who are not showing. So you can't really know if another person has the virus or not unless they've been tested. And as it stands now, we're not regularly testing everybody all the time. So I guess the take-home message, at least for me here, is that you don't need to be sick, and you can't base a judgment on somebody else just by looking at them, because we don't know. Okay, next. So the best defense against viral transmission really is washing your hands. And that might seem incredibly simple. And why is that? And that's because in the beginning, I remember I spoke about the fatty layer that goes around the virion, the genetic material inside. That fatty layer is pretty much dissolved or degraded by soap. And it needs to take a bit of time, though. The soap needs to get in there. It's like what happens, when you have your sink and you drop the soap in and all the oil and grease goes like that. It's pretty much what happens to the virus. The soap just rips through it, breaks it apart. And then when you rinse your hands, the water washes those bits and pieces of the virus away. So it just happens to be an incredibly simple and effective way of making sure that you don't have any virus particles on your hands. It's not magic. It's just a little bit of science and common sense. Okay, next, Pam. The other thing that works really well is staying home and staying away from other people. Again, because we don't know who's sick and who isn't. And so if you stay 6 feet away, it helps you avoid other people's droplets from singing and laughing and talking and eating. Aerosol transmission, we still don't know. And there is research that's going on, but at the moment, because there's so much droplet transmission anyway, the real focus is on keeping people as distant as they can be while still functioning. And that it's not just talking, or it's not just sneezing and coughing. What we've really learned from this virus is it's laughing and eating and singing and all the fun things that people like to do when they're together that are transmitting droplets that can be infectious. Okay, next. Cleaning and disinfecting. These also work really well. And before you go off and spend a lot of money on fancy disinfecting products, I just like to put it out there that there are recipes for bleach that are cheap and super useful. Like my Superstore, you couldn't buy a disinfecting product. There was no Lysol, there was no Fantastic. But the good news is that a couple teaspoons in a liter of bleach is all you need to get rid of this virus. It is very easily denatured by the use of just common household 5.25% bleach that probably everybody has. So the bleach solution works far better than anything like sodium hydroxide or any of those other kinds of cleaning products. The other thing that's very useful is alcohol solutions over 60%. So those are good for tools or electronics or things that you don't want to put bleach on. We know that surfaces in bathrooms, just given what we don't know yet about the potential for transmission in those spaces, we need to be sanitizing those frequently, and that these shared objects are probably really important to be considering, like phones, pens, touch screens. So there is guidance on how to clean these. Most of them include an alcohol wipe or solution, and to just be very careful to not let liquids pool on things like phones or touch screens because they can actually impact the working. And never use vinegar on screens, because the vinegar can degrade the optical coatings. So some people think that, and vinegar is not useful as a virucide. It just does not have antivirucidal properties. So again, alcohol or bleach are two of your simply accessible main compounds that you can use to effectively get rid of the virus. Okay, next. So Health Canada, because there's been so much demand for products, has a very handy database that includes both disinfection products as well as hand sanitizers. And I'm sure most of you know that the breweries have been making lots of different hand sanitizers, although there's lots of problems with them now because they're putting them in beer cans and people are drinking them. So it's just become a complete mess. But if you want to see if the hand sanitizer that you have has been approved for use during COVID-19, there's a list here. There's also a list of disinfectants, both industrial, commercial grade, and ones that you can buy at Superstore. If you want to disinfect large spaces or small spaces, there's a list here of products, and this changes all the time. So if you want to know, you can look it up. You can use the DIN number, the drug information number on the bottle, or even sometimes the brand name is enough, and plug it into the database and it'll tell you what you need to know. Okay. Is there one more slide? I can tell you what doesn't work. So just before we leave, vinegar is not virucidal. Oil of oregano does not work. Essential oils are not virucidal either. So, and homemade hand sanitizer does not work either. So we recommend that people only use approved products that are purchased and don't rely on things that say that they're being sold at yoga stores or health food stores or anything else. And again, just a couple of teaspoons and bleach and water is super effective.
So that's all.
Okay.
That's all this I have. Yeah. And
okay.
Then should I go to the link that you sent me?
Sure. That was so just to show you that Canada has had a fast, so if you scroll down, so this is our federal government is collating the data every day on what what goes on in COVID in Canada. And that gray part on the end means that a lot of that data is still coming in. Those numbers often look low because we're still waiting for information to come along. So as time changes, but as you can see, this looks pretty good, right? We've kind of had our peak and it looks like we're coming down. This may be what's known as the first wave. It's possible that that could go back up again as we all go out and interact with other people's droplets in places. But we're hoping as a country that this downward trajectory continues. If you scroll down, Pam.
Yeah, there's just a bit of a delay.
Okay. This explains the age distribution of people. So you can see that it isn't just the elderly that are developing this disease. There's lots of people, middle-aged people that get it. And look at that, there's even people, children that are developing COVID-19 in Canada as well. So it is an equal opportunity virus. It impacts, so these are cases. These are not deaths, they're cases. But it goes, so if someone tells you that middle-aged people don't get the virus, you can clearly point to this fact that in Canada, that's not the case. You want to scroll down. Information about, so in the beginning, most people that they knew came from travel cases, but now we see 81% in community settings. So that really means that the virus that we have now is circulating amongst Canadians and between Canadians. And that's mostly because travel has been restricted, but once travel is opened up again, this relationship could change. So each province has reporting. So if you want to know what the state of the virus is and how many cases there are, you can click on your province. And then Pam, that below there should be the big map of the country, is there not?
I don't see it. No, I'll go up.
The top, was it at the top? Okay, maybe go down and hit Ontario. Let's go take a look. So to date, we know that Ontario and Quebec have been disproportionately affected by COVID compared to everybody else. Oh, okay, status of cases. So this will allow you to see every day, if you haven't or don't already listen to the news, how many cases are coming in. You know what, Pam, I'll send you a link to the map so that we can see. But what we do know now is that Ontario and Quebec have the highest level of cases, followed by Alberta. But this is a very dynamic situation and could change at any point over time. And so that's part of why we need to remain vigilant. And the future, as we allow people to go back out, we really don't know how it's going to go, which is not a comfortable situation for everybody. But because that curve is going in the right direction and we seem to have things somewhat under control, us going back to work does seem plausible if it's done with care. And I believe that that's what the next part of this session is about, is how we can safely go back to work, keeping in mind some of these virus-specific factors that are leading to transmission. And so I think I'll stop there and I'll send you that map link, yep. Pam.
Sounds good. And
were there questions that I was going to take at this point in time?
Yeah, we are going to stop for questions right now. So Anne-Marie, can you hear me okay?
Yeah, I can hear you.
Okay. Anne-Marie is here for a bit to take your specifically your health questions. We'll get into some more practical questions, but now is the chance. So Erin and Jeff, do you want to help me with tracking down some comments and questions?
Sure, there was one here from Neil T. Anne-Marie, do you think there will be a significant second wave? I don't see how we can avoid it with the issues in Ontario and Quebec.
Can you hear me now? Yep. So that is, it's not anybody's guess, but that issue is still up in the air. So northern Japan has had at least 2 second waves at this point in time. Singapore has seen a small second wave, but they were actually able to isolate it really quickly. It turned out to be in migrant workers, and they were able to get a jump on that. So one of the issues with second waves is how well are we able to see where the initial index cases or that cluster is coming from and how quickly they're able to contain it. And that's part of why contact tracing software is becoming really important. And there's all sorts of different systems, and there's ethical and privacy issues, and how are they going to do this? I'm working on opening up playgrounds, and so maybe everybody has to write down what playground they went to and submit it to somebody going forward. We don't know yet what the recommendations are for being able to find people as soon as possible to minimize the impacts of a second wave. Okay.
Okay, any other?
There was a question early on asking whether the size of aerosol COVIDs was that bigger or smaller than radon?
Oh, you know what? I don't know if I can answer that question. So that's a great question. Let's put that on our list for something to look at.
And then also the prevalence of non-typical symptoms. Two examples were given: brain bleed or sore eyes. Are there stats on that?
Those are things that people have been talking about, the neurological involvement, as well as the sore eyes. They finally listed loss of smell as an agreed upon, but the sore eyes is another one that's also being looked at. Part of the problem with that is it's also related to allergies, which are incredibly common. So that's another one of those symptoms that's being examined, more so even than the brain, more commonly anyway, than the neurological involvement. That seems to correspond with the strokes. So that part is troubling, because that's such a severe thing for a relatively young person to develop.
One observation about the toilets in the hospitals and the public places often don't have a lid on them.
Yeah, there's probably a lot that we can do in public spaces to reduce viral and disease transmission. There's a lot of things we're learning, and that might very well be one of them. Airline bathrooms is another space that's being really scrutinized at this moment in time, because they're often so small and they don't clean them after every use. And I don't know if anyone has flown in the last little while, but personally, that's a space that I would be really worried about too. And most people who travel often comment that they get sick from traveling. So there's probably a lot of things that we can do better, and maybe a toilet lid is worth the extra $10 that it costs to install those in bathrooms, because it might really have a big impact. So we're learning a lot. Physical distancing at urinals is a real topic. So right now, public health is grappling with how do we do that in men's washrooms. So I'm not super familiar with how a men's washroom works, but I'm sure the men in this crowd will know more about that than me, sooner than me, because they're going to have to do something around those in public bathrooms.
All right. Have you seen any studies regarding HVAC in office buildings, stores, etc., in particular the use of MEV11 filtration or UV lighting to reduce the spread?
This is a pretty active area of research. So that Chinese restaurant study was a study of an air-conditioned space, and I can send the details for that, because they did look at the HVAC system. Multi-unit residential buildings is another area where they're looking at ventilation patterns, but because most of the systems push air out, essentially down and out, those systems they don't think are contributing. But as we all know, there's a lot of poor ventilation, and this is someplace where I think a lot of our members have a lot of expertise in this particular area. So I think that we're going to see better guidance for indoor air quality that come out of COVID that might be beneficial for all of us. But that particular standard, no, I have not seen that. But one other thing about the UV light, the far UV, so lots of people are champions of this. There's also, though, those are problematic systems both for eyes and for skin cancer. So the widespread use of far UV for deactivating a virus, it might work in theory, but I think in practice there's still a lot of huge questions about the safety of that. I know that there's ones to clean your phones that people are buying that are effective for sanitizing electronics, but on a larger scale, they are beginning to put some of them in airports that people would walk through, but can you really stand there long enough with that amount of UV without hurting your skin or your eyes? So these are big questions, and because people are rapidly trying lots of different pilots, we'll see the answers probably in the next while.
Here's an interesting question about recording deaths with related to COVID. So are there any rules around reporting a prospective cause and effect? So for example, the person may have had COVID when they died, but not actually died because of the COVID.
Mm-hmm. So you can see different countries have different strategies for this. Like obviously in Russia, you can have COVID and die of pneumonia and you're not going to be considered a COVID death. In the United States, they're a bit more scrupulous about how they apportion the cause of death. But what we believe at the moment is there's probably more deaths due to COVID than we're actually reporting. So there's a variable called all mortality or overall mortality that they're looking at, and overall mortality is up in general, even without attributing it to COVID. So it's more likely that we're not capturing as many people as we ought to be as a result of this, not just that more people are dying in general. So the attribution, it's challenging. You can imagine you have a hospital full of people that are dying and then people dying at home. In New York City, they knew that people died in their homes because they didn't want to go to the hospital because they were concerned. They didn't want to overburden people, or they were just alone and they died at home. And then a coroner has to go and find that person and test if they had the virus. And that's just probably not being done. So the likelihood that there's a higher death count than what we're seeing is likely. Probably not so much in Canada, but in places that have been overwhelmed, like Italy and France and New York, probably yes.
All right, well, I think we need to keep moving. So
Okay.
Thanks very much, Anne-Marie. We will keep track of the questions. So if there's some that we missed, we will go back to them and get Anne-Marie to answer them. But we're gonna keep moving on.
Okay, thanks so much.
Yeah, thanks. Okay, so I'm just going to go over a couple basics from our perspective. So just for CARST and for C-NRPP professionals, some of the things that we would like you to consider as you're starting to get ready in the back to work mode. One thing that I just wanted to say is thanks to our board. We have, the CARST board really has a wealth of expertise. We had a number of people diving in, researching things on this issue, contribute. So we do have a resource. Erin's going to go through that at the end of things we've been compiling. As Anne-Marie mentioned, things are changing rapidly. And so we have put together bits of information, but it's really, not only is it changing rapidly, but it's regionally different. So these are things that you need to go kind of and go check on, keep up to date on. And so we'll touch on those as we go through. All right, so COVID-19 has imposed limitations on us, but it has also provided us opportunities for our members to set themselves apart and lead by example. And this really is a key message that we at CARST and C-NRPP want to put out there. We are talking to our homeowners, talking to Canadians about an invisible health risk, and we want them to take radon seriously. And we really need to lead by example with this COVID, that we want to make sure that we're taking people's health seriously with respect to COVID, as well as we're expecting them to take their health seriously with respect to radon. And so we have developed a statement, CARST C-NRPP regards people's health as an important priority. Our certified professionals are committed. Sorry, I'm trying to get the dashboard off my screen so I can read my screen. I'll start again. Our certified professionals are committed to helping home and building owners protect themselves from the negative effects of radon exposure. And with that same commitment, we recommend that our professionals take an approach of prevention and preparedness with respect to COVID-19 to protect themselves and their employees, as well as the occupants of the buildings where their measurement and mitigation activities are conducted. And so I put this out for you to see so that you know what I'm saying. We're expecting our certified professionals, and we're telling people that of course you're going to take this seriously because you're considering things from a health perspective. And so some things that we want you to keep in mind is to be transparent with your clients. It's really important to set their expectations, to set standards and follow through on those standards. Give your clients and other members of the public confidence that we're being genuine with taking care of their health. And also consider the perspective of your clients. So when you develop materials, most often we start by developing materials from our own perspective, but take a time and to stop and take a look at it from the consideration of your clients. Make sure that you've got clear, open communications, help them anticipate their new environment that you're going to be working with. Remember, trust is easy to break, but really hard to get back. And so we really want to value the trust of your prospective clients and of Canadians. Just a quick note on this, as things have been opening up, I'm here in Manitoba, so services have been opening up. I got an email from our physiotherapist saying, you know, we are back into business, but things are not normal. And they went through some clear procedures that we would expect if we were going to go to an appointment. They set out their expectation of how they wanted to treat us. Things like, you know, we love to have a welcoming environment and welcome you into our waiting room, but you know, under the new normal, you're going to have to wait in your car, and we'll text you or we'll let you know when it's your turn to come in. Things like that. So it was really clear in their communication to me of what they wanted our relationship to be and what their services, what they desired their services to be, but really clear of what I was going to expect. And what we have found in talking as a group about this, and I know all of you across Canada have found this and feel this is an emotional issue. And so we do need to sort of stop and think and be transparent with your clients. From that perspective also, I think this is not a fear-based issue. We don't need to be fearful, and we don't want to instill fear in people. We just want to be preventative and proactive, but not from a place of fear. We recommend that each company completes the following steps. So 1, confirm your provincial and regional recommendations. This is different all across the country, and in some provinces, it's even difference within regions. So we know some of the northern regions, the more remote regions have different regulations. We know more densely populated areas have different regulations. So you do need to confirm with your local jurisdiction that you're going to be working in. And you need to keep on top of it. As we've seen, these things are changing daily. And I think, you know, the government has been doing their best, but we all make mistakes and things change quickly. And so just make sure that you keep on top of that. Next, develop a company statement. And then after that, develop internal company procedures and develop clean homeowner communications. So those are the steps that we expect all of our professionals to think through. All right, so again, to reinforce this, the recommendations set by public health authorities differ across the country from region to region. As such, the procedures established by C-NRPP professionals may not all be the same. And this is a really important thing that we want to stress. This is not to be a point of competition. We want to have a united front on this. And so we expect, and we want to help all of you figure out what your processes should be look like. And it may be that you feel like your competitor within the same city isn't taking things as seriously, or perhaps is taking things too seriously, or whatever. Reach out and have a discussion. Talk respectfully with each other about it. We are here as a resource, so if you have questions, we will try and help you find the answers. We don't have all the answers, but we will certainly share, you know, whatever we know with you, and certainly try and be a resource. We can also be a resource for communication and help you communicate with each other. But we want to be clear that this is something we want to be united on. Again, regulations may change, so you need to keep up to date with provincial and regional recommendations. And in the midst of focusing on all these new restraints and this new issue, don't forget your typical health and safety requirements. You still have to follow within your jurisdiction your typical workplace health and safety, and we want you to follow that, right? We want to make sure that you're safe. This is an emerging graph, at least it's new to me, that I've just found in the last few days, and we've been talking about today. This particular one I grabbed from the WorkSafe BC, so I put the specific link there for you, and we will provide this to you as well later. But it's a really good thought process of when you're considering steps. And it mirrors a lot of what we talk about with radon. So I thought it's a really great one to be using right now when talking with COVID. So consider first the elimination as your first level of protection. Next, the engineering controls, instilling barriers. Third, administrative controls, using rules and guidelines. And then finally, protective measures, PPE. And so this is a really good emerging graph that's coming up to help you kind of think about the process and way that you're developing your measures. Okay, so Again, first step, check your local regional recommendations. After that, develop a company statement. Have some clear communication and communicate it with your all the people within your company. Include concepts of making health a priority and optimizing your client's experience. And make sure that you include this in your current workplace health and safety policies so that you include it in all your documentation. In addition, we recommend that you develop a public-facing one-page document that you can communicate with your clients, your COVID statement, and then also some of the health and safety measures that will affect your interactions with them. Next step, develop your internal company procedures, or really we call these our standard operating procedures, SOPs. Again, confirm your local recommendations, make sure that they meet those. But here's some things to consider. So first thing is an employee health check-in or a fit for work. So make sure you include this in your in developing your tools and in a daily check-in. Next, consider scheduling work during low occupancy time within the building or the house. Include some physical distancing measures or contactless interactions between client and coworkers. Ensure access to hand washing stations and bathroom facilities. These are things that you might just have assumed that you were going to have accessible in the past, and now suddenly a simple thing is a little bit more important and more of a barrier when you're going into somebody's house. And so we'll talk a little bit more about this, but you may not be able to assume that you can just use the bathroom facility within the house. And think through what is your stand on that, how are you going to handle that when you're going into people's homes. Next, look at contactless interactions with bystanders. So there's more than just you and your client. There's other subcontractors, there's other people that just happen by. So just consider some of those measures. Cleaning and disinfecting services, including materials left behind, cleaning and disinfecting tools and materials removed from the site. Also, and we will talk a little bit more about personal protective equipment, PPE. And then also develop suggested communication for your employees. This goes along with trying to ensure that you're making your clients comfortable. There are so many things that as we talk about things these days that are emotional with respect to this issue. And so, let's just put some things down to help your employees communicate why they're wearing something like a mask or whatever it is you decide that your employees need to wear as part of their work, why they're staying physically distant from the individual, why they're using contactless things. Using phrases like, I don't want to get sick in case you're sick, may make the person feel defensive and attacked. And you really want to value your relationship with your customers. So think about ways that you can say, we're trying to protect everybody's health, or we're trying to ensure that everybody stays safe, and think through phrases like that. Also use public signage. There's lots of resources out there, and we will share some links that we find with public signage. This will again help you clearly communicate with your clients, but also help you remember. There's so many stories these days of people touching their face and forgetting. If you have some public signage of these simple measures that you expect yourself, your employees, and your clients to keep in mind, it will help to remind you throughout your day. Next thing is record keeping. Make sure that you have proper record keeping. When you develop your guidelines, even keep a copy of the date and the website where you got the recommendation from, because as we know, things are changing. And so you might have done something based on today's recommendation, and some new information may have come to light. Things might change, but you might not have caught that for a bit. So make sure you keep track of even things like that, when you got that information, where you got it from, just for your own assistance. And then also think through things like what happens when you deal with a potential COVID exposure within your organization. And I will say that I think it's really important to consider talking firstly with public health. So I don't think this is something you have to deal with yourself, but make sure that you talk with public health first. But just consider, this upfront before you're in the middle of dealing with it in an emotional situation. Okay, and then develop homeowner resources. We recommend that you develop contactless resources, and again, clear clear information. So this might include sending contracts that need signing in advance for electronic signatures, setting up contactless payments, creating occupant questionnaires for buildings where you will work, setting up meetings, use virtual meetings like this. You can also use FaceTimes, phone calls. We've heard stories of professionals using FaceTime to show them the work they're doing, or maybe you've got a question on site. You can FaceTime your customer to, ask them a question about their specific house. Think about developing homeowner information to gather relevant information and ensure any waiver of liability that needs to be signed is provided by an electronic signature. Really, prevention includes reducing proximity and length of time of those interactions. Okay, so we have had a couple questions come up about liability, and so a couple recommendations that have been provided to us is documentation. So maintain your proper documentation of your procedure. Again, as I mentioned, cite where you got that information from, just in case information does change. Maintain proper documentation of employee training, morning check-ins, and unusual circumstances during the day. Just record it for yourself so that you have a record of it. Maintain proper documentation of client responses to pre-entry questionnaires. And also this concept of asking permission to enter premises. So do you ask your clients to sign a waiver, a COVID waiver? It seemed like another option may be to ask permission to enter the premises and have it clearly documented that they obviously are understanding that you're coming into the premises. We did reach out to some of our insurance contacts just to find out what their recommendation is. And this was a quote that I received back. So from a commercial general liability aspect, coverage would respond to protect a client if they were sued for transferring the virus from one person to the next, as there is coverage for bodily injury. At this point, however, it would be nearly impossible to determine where people obtained the virus from, or if a customer was at fault or vice versa. However, we do expect there to be a lawsuit brought forward regarding this at some point, likely as the economy picks up and the virus is still spreading. So this was a quote that we received from one of our insurance experts. And so we thought we would share that with you. Obviously, there is no precedent setting. So as far as people looking for lawsuits, we don't know what's going to happen. And really, there's lots of questions. There is this website that I put, it's a Canadian law site, and we will provide it to you in some materials, but it is a good one to check for some information on legal liability from an employer's perspective. Okay, so I'm going to hand it over to Jeff now. So in considering those things, and just to reinforce the fact that we're not going to write your procedures for you for a number of reasons. One, there's too many variables, and there's too many regional, provincial variables, but also just practical variables from your perspective. But we asked Jeff to come and share his perspective, his experiences. And so he's going to share some of the things that he's been doing with us. Jeff, do you want to try and share your screen? Make sure that you're able to do it.
Sure thing. Yeah,
yep, it works. Good. All right, I'll hand it over to you.
All right, perfect. Thanks a lot. Thanks a lot, Anne-Marie. That was awesome. I learned a lot of stuff this afternoon already too. And thank you, Pam and Aaron, for the introduction. So I'm going to say the same thing that everyone else has said. Like, I'm not going to be, any of the things I'm talking about here today are just things that I did in my own businesses. It's not to say that's what you have to do. It's just an example, and maybe it can be a thought starter and to help you think of some of the things that we need to think about. So please, it's not a guideline of what you need to follow. It is an example of potential things to do. So let me get into it. I'm going to push play. So that's the big screen. Okay. All right. So what I'm going to cover right now is, first of all, internal procedures. So I'm going to preface this. So I do own a radon measurement and mitigation company. So we do radon, we do short-term testing in real estate transactions, we do long-term testing, and then we do mitigation work as well. I also own a home inspection business where we have 5 inspectors in the field inspecting homes for buyers and sellers. So I also own a window and door company, which is not related, but just so you know, I have 3 very different types of businesses that had to react very differently when this came up in March. So I guess I got a lot of experience really fast. Not that I was looking for it, but that's what happened. So what we did is we set up internal procedures first. So I'm going to talk to you about training for those internal procedures, a daily routine, tracking, as Pam had said, documenting things, and our office procedures, what we do at the office where people can come in and the public can interact. And then we have external procedures as well. So our client communications and expectations from them, from us to them and from them to us. Sanitization station, I'll talk about that a bit. I think Brooks earlier said that he has a wash station in the back of his truck, so I'll kind of show you what we did there. And then I'm going to talk a little bit about measurements in the field, radon measurements in the field, and radon mitigations in the field, and just a couple of the small differences between them and how we decided to handle it on our end. All right, so training. So of course, like Pam said earlier, I'm recapping a lot of the stuff she said, but ensure all of your staff have the proper training for their specific job description. with those different businesses, of course, we have different people who need different training, because some of our people are in the office and stay in the office, and they have to know how to handle customer interactions. Then we have other employees that actually go out into people's homes and are interacting with people in their homes. And we have other people that are doing work and not coming in contact. So it's all different, but make sure everyone has the proper training. And then of course, document that training and record it all. Any internal or external training you do, have it all documented. And I love what Pam had said, if you're going to base things on information from a website, make a note of the date that you based it on, because everything's changing every day, right? And as did our protocols and procedures as well. Educate your customers on your COVID training. I think that's very important. Like it's been said already, we really need to make sure our customers feel at ease with us coming into their home and interacting with them. And we are all conscious of their health. It's why we're in the radon business in the first place. So just extend that out to the COVID situation. So make sure we educate them on any COVID training you've done with your staff so they know. Internally, train on your own COVID procedures. Gather signatures from all employees that they will follow the new COVID guidelines. So if you're putting out procedures, get a signature and put that in their employee file, so then you have documentation that everyone was told to. I know we're going to, as business owners, we can put expectations on our employees, but we know that they don't always follow them 100% of the time. So this is a protection for the business owner as well. Externally, have your staff complete COVID training. So this training is a really good example of it, so that you can tell your customers that you've done some training on COVID and learn things from your association. In the home inspection industry, for example, our association put out a COVID, how to do home inspections with COVID. So all of our staff took that. So any kind of external training you can take and learn from, complete that, and then you can also express that and tell your clients that you did this training as well. All right, next slide. So daily routines. What we did, we put this daily questionnaire in. And the reason we put it in, actually, was before that it was something that people talked about, but we're asking people when we go into their homes, if they've traveled outside the province in 14 days, if they've been in contact with anyone with COVID, or if they have any of these symptoms. So I really felt that, by asking the people of houses we go into, we need to start asking ourselves these questions as well. So we do this every morning. And, it depends on the size of your company and how you're going to do it. I'll tell you what we did is we have a Facebook chat group with all of our home inspectors. So we just get every one of our home inspectors, because they don't come to the office. We get them all to answer that question every morning before they go to work. So we all know they haven't traveled, but their answer is no and no every morning, and that's what we want to see. And then document that information as well. Please use Health Canada's guidelines for these questions. But like I said on here, travel outside the province, symptoms, and COVID contacts, those are the three kind of main ones. I know when I go to the liquor store, that's what they ask me. So that's the answers we need. And then document and share that. If you're doing this and asking your employees these questions every morning, explain that to your customers and let them know that. It'll just show them how you're trying to take care of their health, right? And that's what we're With the inspection business, we sometimes will book our inspection a week or 10 days in advance. So what we've done now is we ask that question when we initially book our inspection, and you can call and replace inspection with mitigation here, and then we actually request that information, just an update, 18 hours before we visit the home again. So just because there's a delay, and a couple of our clients or our sellers who are not our clients will say, well, I just answered that 3 days ago, and I understand that, but I'm asking my employees every day, so I'm just asking you so that we can all be on the same page. And again, document and share all that. Tracking, document. We're going to keep talking about this, but track all that education, maintain signed copies from all your employees, track all your responses to your employee morning health questions. So it's great to have those questions, but then put that in a spreadsheet. And it should all say the same thing, but then it's tracked. And if anyone ever asks you, because of something that happens down the road, you have that to back yourself up. Track your responses to your customers' health questions as well. Document any situation that was out of the norm. And I'll talk about this just real quick. So we've had a couple of instances where we had an out of the norm answer. Instead of just saying no symptoms and no, we haven't been in contact, we had someone who's, and I've really found this, and I believe we're lucky to be in the country we're in, because as Canadians, I find that everyone has been very honest and open to us when we're asking these questions. They're weird questions to ask people. They're very private. And I actually preamble my questions by, listen, I'm sorry, I don't want to ask you these questions, but just because of what's happening, we're doing that now. So we've gotten people that said, listen, I got a cold now. I've got a runny nose, but I do have allergies, and it happens every time this year. This is the season for allergies. So, what we'll do is when that information comes to our office, I'll make a phone call and I'll have a conversation with that person and really get into the nuts and bolts of what's going on. And then I will talk to my employee who's scheduled to go to that house and make sure that everyone is comfortable with the situation. If there's ever any little one iota of uncomfortableness, then we're just going to refrain from doing business or that transaction. And we've done that. We've walked away from an inspection because of a out of the norm answer, and we've scheduled things later in the future to make sure that person's sniffles didn't become something bigger, right? So, and I believe if you're being upfront and being very open and transparent, then you're going to get those open and transparent answers from people, and you can deal with them properly. But as Pam said earlier, you have to remember it's a very stressful time, and there's a lot of emotions going on. So just pick your words wisely, I guess. And at the end, document. Always document. Document those out of norm things, and document the conversations you had as well. Office procedures. So this would be, for people that have an office space that you may have public interaction. There's lots of, I think the signage companies are the only ones that are increasing their business right now, because they're selling all kinds of floor stickers and signs to go everywhere. So that stuff is readily available, I believe, from all of your suppliers. To ensure that social distancing. So if you do have a showroom type business, then, put signs down on the floor for social distancing, signage on hand washing, maximum capacity of people in an office, for example. Make sure that signage is clear and understandable, and have any kind of PPE available for staff and visiting customers as it's relatable to your business, of course. And again, follow your government procedures. There's, I know we're in New Brunswick, and WorkSafe NB has come out with a document on procedures to follow. So, we're following those in our storefront businesses as well. And that would be our advice to you here. Client communication and expectations. I said this earlier, don't keep your COVID policies a secret. I don't know if there's a big marketing campaign around it, but it should be front and foremost. So when people contact your company, it's easily accessible, so they know what your COVID standards are, what your policies are, and how you're going to be handling yourself and what your expectations are. Your clients will feel better if you tell them how you're handling their health. Really, it's going to give them a sense of protectiveness. So that's really important, especially today, but it's always important in my opinion. Your initial communication should set the pace for your transaction. So depending on what that transaction is, if it's going in the house to set up a radon monitor, a short or a long term, or if it's doing a mitigation, make sure that you set that expectation so that the customer knows how you're going to be handling yourself and what you expect from them in return. It'll just keep the questions out of there, and it'll just make everyone feel more comfortable about it all. Excuse me. What do you expect of them to protect your employees? Make that messaging clear and concise. That's very important. And something that I found in our communications, you know, I'm really wordy, as you can tell. I can keep talking, but when I write long paragraphs as well. But it's harder for people to read that. You know, break things down into point form. Make it smaller, easier to take in, right? So that when they're reading this, they're not going to get tired out and not read the bottom two sentences, which were the most important in your whole message. So clear and concise is very important. There's been some conversations about waivers. I've come up against this in the real estate industry. A few people have commented as well. I think Ron in New Brunswick commented earlier that he has to sign a form. There are waivers. There's some real estate companies that make us sign a waiver before we go in. And actually there's a request of sharing COVID policies that go back and forth between our company and some real estate offices. So that is something that I would, again, refer to your provincial organizations, your health departments, and talk to your lawyer. You know, if you have a business and why not talk to your lawyer about a waiver and how it should read and what it should say. Be careful that you're not restricting people to do business with this waiver, but make sure that it's a communication tool. Sanitization. So yes, we need to be sanitizing all of our stuff. So this is specifically on what we do in our home inspection and radon business. So this is kind of getting into the meat of it. We created basically a clean room in our truck. So most of my guys, all of my guys have half-ton trucks. So we've got a box and we've got the front cab. So again, I know we all have different vehicles, but just, you know, this is just an example. So take this and apply it however it applies to you. So what we do for our clean room in our truck, nothing comes into that cab of the truck that is potentially contaminated. We have sanitization stations set up in each truck at the tailgate. We've actually, in mine, I cut a piece of 2x6, it sticks right in there and it holds all my stuff so it's not all flying all over the place. Because I did lose $10 of liquid gold sanitizer here not long ago from stuff sliding around. So that was just a trick I learned. So what my guys do when they come out of the house, be it for a measurement, a mitigation, or an inspection, they come out and immediately go to their tailgate. And by the way, their tailgate is left open when they go in the house so that they don't have to touch the tailgate handle with any potentially contaminated hands coming out of the house. So they go to their tailgate, open it up, and then that's where they sanitize their tools that were in the property and their hands as well. So that's our sanitization. I think I have a picture. Yeah, so this is a picture of our truck. So my truck actually. Over on the left-hand side, I bought the expensive shop towels for this time around just because they don't rip and tear and it's easier if you're wiping stuff down. It took us a while to find some Clorox disinfectant wipes, so I'm hoping people don't know where I live. They're going to come after me for these, but I did have a couple. I had two, and each of my guys have ones with disinfectant wipes. The little black kind of pop-up thing is actually a $5 pop-up garbage can that I got at Canadian Tire, and it just folds down, but it's great. I can tie it to the back of the truck, and any of my contaminated things, paper towels, disposable gloves, which we'll get to in a minute, they all go in that can and not in our normal garbage. So it's all contaminated garbage in there. The couple of blue boxes, those are nitrile gloves. By the way, we use our phones and iPads in the field a lot with inspections, and the nitrile gloves, you can still use your devices, the touch screens, with those gloves. So I tested them all before I purchased those, but we use gloves. And I'm going to talk about the gloves in a minute because there's a conversation about that. Clean boots, now that's a manufacturer, but those are just like a boot cover that we wear. I chose clean boots because they're washable and they're not slippery. They have a tread on them, so you're not slipping and sliding on floors. And I become a clean boot distributor in the Maritimes because there wasn't one, but you can buy them online on clean boots. They're pretty slick. Then I had a bunch of different disinfectants, and these are the levels of disinfectants we had. So spray 9 is the only thing I could find at first. And then I had a germ 9, which kills germs within 10 minutes, and then germ 5, which is 5 minutes. And then I ended up finding alcohol sanitizer. Our local vodka distiller here in Moncton has been making jugs of like I think it's a 80% alcohol solution. So we use that all the time now. And then the bucket, I'm advertising home hardware there a little bit, but I just bought a bucket, and I call it our sanitization bucket. So when our guys go into the house, they put all of their tools that they're going to bring in the house into the bucket, and they bring that bucket into the house. You can trade that out for a tool pouch if you want, but you have to realize that that tool pouch now could be potentially contaminated. When they come out of the house, they bring the bucket out and they go to their sanitization station. They lay their tools out on their tailgate and they sanitize with that alcohol spray and make sure everything's sanitized, flip it all over, put it in the sanitization bucket, make sure to sanitize the bucket as well because it is now contaminated or potentially contaminated. Now we don't use this alcohol spray for our electronics, for our phones and our iPads. Remember, if you get a phone call when you're in a house, even though it's not your tool, if you touched it, it's potentially contaminated. So we use alcohol wipes. So and they're hard to find too, but little alcohol wipes to clean off any of the electronics or moisture meters, infrared cameras, that kind of stuff. So this is just a list of the stuff that we put in our sanitization station. I'm going to look at the comments after. If anyone has any other comments on things to put in there, I would love to hear it too, because I'm always learning as well. And then hand soap and water. Sometimes we go into a house and maybe the water's turned off, maybe there's no power, or maybe there's no soap. So my guys all have soap dispensers and we all carry around a 4-liter jug of water. It's not warm water, but it's something that they can wash their hands with. You can also get kind of soap towelettes and stuff to use as well. Now gloves, I said we were going to talk about this. First of all, the virus is not transmitted through the skin. We learned that from Anne-Marie earlier. So gloves are not necessarily protecting you from the virus. It is an aesthetic thing, in my opinion. And I do have another reason for it. I don't know if you've noticed, but I notice a lot, and especially when I'm on a Zoom call, I can see my face. I'm touching my face all the time. And I'm touching my beard. Yeah, of course, yes. I feel like I'm addicted to my face, and I really didn't know that until COVID. But when I put gloves on, and I'm one of the guys that chews their nails, and I've been chewing my nails since I was a kid, and I really find it's really gross now, but I still do it. And I do it almost subconsciously. So when I put these blue gloves on, and there's rubber gloves on my hands, as soon as my hand starts coming to my face, it's a reaction. I'm not touching my face with that rubber glove, and it makes me think of it. And I for sure am not chewing my nails through my gloves. So I chose with our company for our guys to wear disposable gloves because in real estate in New Brunswick, they've put that as a recommendation. When you go into a home, you wear disposable gloves. But the most important part about the gloves is how you put them on and how you take them off. And actually it's called donning a glove and doffing a glove, which is kind of weird, but that's what the real words are. So you have to know how to put them on. Putting them on is fairly straightforward. There I am again. But taking them off is the most important. So when you have your gloves on, anything you've touched in that house is considered contaminated. Your gloves are contaminated now. You can't just start ripping your gloves off because now you're spreading that contamination around. So and I'm not going to get into all the techniques, but there's videos you can watch on that. It's helping the people in the house, I think, show that you're doing everything you can wearing the gloves in the house. It's an aesthetics thing. But really, if you choose to not wear gloves, that's all fine too. Wash your hands very often and wash them all the time. If you're wearing them, be aware that that does not protect you, and be aware that you're actually taking that contamination now in the house. And as soon as you come outside, it's on those hands or on those gloves. And when you take them off, it's still on those gloves. You put them in the garbage can, it's still on those gloves. As Anne-Marie said, we don't know how long it's going to last on these surfaces, but you have to assume, just like we're assuming the house is contaminated, we don't know it is, we have to assume it is, we have to assume those gloves are contaminated as well. So yeah, it's not, we're not saying wear gloves, we're saying if you wear gloves, these are all the things to be aware of. I hope that clarifies it. Now radon measurement, when we're in the field. So here we go, I have wear gloves when entering the building because that's how we operate. But they're to be considered contaminated, don't touch your face. And all devices you touch with gloves are considered contaminated. Like I said, your phone. I've gone in with a radon tester, continuous radon monitor. I'm going into a house. My phone's in my back pocket. I plan to not touch it, but the phone's gonna ring when I'm in there. And when it rings, I touch it. Now I have to disinfect that phone. Can't put it back in that pocket. I try to keep everything in my hands or in that bucket. Bring disinfectant and wipes, disinfectant wipes or disinfectant and wipes when you enter the home, so that you can disinfect things when you're in the home if you feel the need to. That tool bucket, disinfect that bucket as well. I'm being a little repetitive, but it warrants it. Use your alcohol wipes. Any equipment left in that house should be considered contaminated. I remember when it first started and I was really focusing on my inspectors and how they were going to handle going into a house. And then my brother runs a radon company. He's on here today watching. And his wife had recently returned. It was really early in March. His wife had recently returned from the States. So at that point in time, we decided, just because we don't know what's happening, Mike was not going out into the public anymore. They were self-isolating their whole family just to make sure that everyone's protected. So I went out and picked up my first radon monitor at a house. And when I'm picking it up, I'm realizing, like, normally I take it all apart, I put it in its little bag and carrying case, and I take the tripod down, put that in the carrying case. But I'm realizing, like, everything is contaminated now. Like, it was an eye-opener for me. So I ended up taking everything out, not putting it in the bags and trying to get that tripod up the stairs. It was a little bit tougher, but when I got it outside, then I proceeded to disinfect everything and sanitize everything. And it's, like Mike says to me every day, like, it's a lot more work now taking a radon monitor out of a house. But we have to do those things. And you know, when we're doing this and we're out at our trucks and our tailgates and we're outside of the house disinfecting, you have to think about this. And I told all of my employees this. They have to pretend that I am next door watching what they do, because I'm not there, but the neighbors are. And the neighbors are watching what you're doing. So make sure that everyone on your team is aware of that and that they're cognizant. So when you're out there and you're sanitizing, yeah, it's a pain. It's a pain in the butt to do all this stuff. But you're actually putting on a good show for your customers and for your future customers as well. So they know that you're taking care of people's health, not just with radon, but also when it comes to COVID-19. So I think that's very important. It's kind of a little bit of a show. We've had lots of compliments from other people that were not our customers that saw what we were doing and said, wow, you guys are really taking this seriously. So, you know, take that example and run with it. Masks. And we didn't really talk about masks a whole lot, but it's on my slide, so I'm going to bring it up. I'm not going to get into, you know, what masks are good. We all know the N95 mask is what they said to use for the health departments. Some real estate companies have told us that we have to wear masks when we go into homes. So we've brought up masks. We wear a civilian type mask. It's a mask that I found a source for, and they have a filtration system in it, and you can wash them 20 times. So that's what we use. We will wear a mask when we're requested by the homeowner to wear a mask. And we put that out there and say, we have them. If any of our guys are showing, if they're sneezing, or maybe he got a sneeze this morning, or he came across an allergen that's bothering him and he's got a cough, then he's going to wear the mask for sure, and we're going to actually inform our clients of that. But if your customer feels better with you wearing a mask, then wear a mask. It's kind of where my head's at. But I'm not saying that tell people that you're helping them by wearing the mask. Just offer it that it's there. There's all back and forth on that, and I'm not going to get involved on what's right and what's wrong. I just think that making the customers feel comfortable is what's right at the end of the day. Radon mitigation, you know, we use all the same kind of things that we talked about up above. But remember, when you're mitigating, there's a lot more equipment coming into the home. And all that equipment should be disinfected once you exit the building. Bring in disinfectant, because some of your tools goes into cases, right? So I would bring the disinfectant and stuff right into the home. So if you're putting your micromanometer away, maybe, and it comes in a case, a protective case for it, well, maybe you want to disinfect that with some alcohol wipes prior to putting that into your case. Now, be careful with your hands, because they could be contaminated too. So you have to be thinking of all that. And then, you know, best practice, I think, you know, disinfect your mitigation system. So if you're installing a mitigation system in a residential property, you know, once you're done your soap test, it's all clean, well, disinfect it. And then you can educate your customers and tell them that you disinfected the materials you left in the house, because that's their new system. Create checklists for yourself or your team. You know, if you're by yourself, create checklists, and you can show your customers, here's the checklist that I go through to make sure that I've done everything. And then provide that to your employees if you have a team. One point I want to make, nitrile gloves, and I spelled that wrong, gloves, they'll rip when mitigating. Mike found that out pretty quick. We're doing a lot rougher work, so they're not very rugged that way. So, you know, a lot of us are wearing work gloves, but when you wear work gloves, you got to remember that those work gloves are potentially contaminated as well. So sanitize them just like a tool and wash your hands often. You know, at the end of the day, we want you all to be the professionals that you are. We're concerned about our fellow Canadians' health. That's why we're Radon professionals. So show them with your words and more importantly with your actions, because actions speak louder than words, and they're watching you, and everyone else is watching as well. I already talked about the driveway thing. I talked about that earlier. But make everyone feel comfortable and make them trust you with that level of comfort, your professionalism. And I think, you know, I think Brooks might have said it earlier. I think we are in a good position in the radon industry. You know, people are now aware of this invisible thing that they can breathe in that can kill them. So, you know, I think there's some congruency there, and you know, I'm really hopeful for all of us in our radon futures in Canada. And if we keep doing the right things and being professional, it's going to help us all down the road. Thank you very much, guys, for your time. I appreciate it.
Great, good. Thank you so much, Jeff. And so that's a great example. I know there's also been some exchange on the chat of things that people are doing. Again, we've been, you know, pointing you back to the resources. And so we do have a document. Just a disclaimer, we are going longer than we thought. We let Anne-Marie go on a little bit longer, not to blame her, but she's just got valuable information, and it's so useful to have her come on. But we are recording this, so we do have more that we're going to talk about, so we will keep going. But we understand if you need to jump off, we will make sure you get their links so you can watch the rest of the material. Anyways, even as you're sharing information, make sure you go back and check resources and make sure things are, that you develop your own procedures that are useful to you. So Erin, I'm going to show my screen. You're up next.
Sounds good. So something we really want to reemphasize. So thanks so much, Jeff, for giving us a practical example, because we talk about all the different types of procedures and, you know, communicating with clients, communicating with homeowners, internal procedures. Yeah, it can be confusing, but Jeff was able to provide really a practical what this looks like in the real world day to day, and some of the complicating factors that you may not think of heading out. And then you get to the situation, you're going, shoot, wish I had a procedure for this. So because Canada's enormous and you guys are all located in different locations, and then you all have different side businesses or main businesses, we cannot and we do not want to distribute a procedure. There are things we want you to do and procedures we want you to develop, but we want you to develop ones that work for you, and not just have a piece of paper and go, yeah, this is our procedure, and like, what's that mean? So basically the best process was to touch on a couple of things and then give you a lot of links. And there's going to be more links than we go into today, because we could just sit here for the next couple of days. You will be getting a copy of today's presentation with the links, etc. So to jump right in, we are going to send some information about PPE, just some of the different options out there and their limitations as they pertain to COVID in particular. What protects you at work may not protect you from COVID. The first slide that Pam showed there was how to properly doff your gloves in a way without spraying everything everywhere and contaminating your hands. The next was a review of how to properly wash our hands. The government has been putting this out from the beginning, but sometimes it's nice to refresh our minds, refresh our memories, especially given Anne-Marie scaring some sense into us. We've included a lot of links. The provinces, especially some of them, have really developed a lot of resources, not just their basic guidelines on COVID-19 for citizens, but also for businesses, for employers, for employees, for construction in particular in some instances. So we're going to just look at a couple of examples. And I kind of forgot how we're going to do this. Am I clicking on these examples, Pam? Or do you have them queued up?
I will have them queued up.
Okay. Well, I can click on them. Bear with us a second. We're going to just show you a couple of them to just give you an idea of what's out there. you are not at all without guidance as you develop these processes. They really walk you through it. Well, I'm sure Jeff can attest to that. He basically followed New Brunswick's instructions, I think he told us, in developing his own processes. So this is embracing the new normal as we safely return to work. This is only one of New Brunswick's very long documents put out by WorkSafe in New Brunswick. So really, as you can see, they start laying out what the new normal is. They explain what it means, the state of emergency. If we keep going down, we start to get into things like directed right at owners, managers, that type of thing. The key risk reducers. We showed that triangle. Don't go straight to PPE. The best thing is social distancing. And then the next thing is engineering ways to reduce the risk, like that plexiglass that's popped up everywhere. Here's the triangle again. Then administrative controls. Maybe some people work this shift, some people work that shift. And then the final option is PPE, if there are no other options. And so this really walks you through the different things that you would want to consider as you assess what's going to work best for your type of business. So that's link number 1. And I mean, obviously, we're only partway through the document.
I'll go to the Quebec links now.
Okay. So New Brunswick has a couple of documents. The other one is really like straight and to the point. Really excellent. I'm very impressed. Then to jump over to my home province of Quebec, in French and even in English, they have these daily checklists for construction sites with really just like, this is what they want to see. This is what you need to do. It involves, you know, you see, water and soap for hand washing. The hygiene rules are posted and observed. That everyone clean down the tools at least in the middle of a shift and at the end of a shift. They've got it very, very specific, being Quebec, instructions. They also have posters that you can put up at work. So reminding everybody of what limitations are in place and when. So this is something that, you know, depending on your workplace, some of these will fit well, some of these won't be a perfect fit, but just as some examples. And I think we've got just a couple more that we wanted to walk you through.
Yeah, I'm just trying to get them to load here.
So going over to Alberta, and here's some of their links. So tips on, open for business and keeping Albertans safe, signage that you can just use, tips, etiquette. So like we've said, we're going to be sending you out not only the slides from today with our basic CARST/C-NRPP guidelines, you know, the basics that we want. Here's what we'll be sending you is this document. So it summarizes everything that was presented today and then a whole lot more. So as Pam is scrolling down, you'll see some familiar slides. You'll see the flow chart of what we feel you should be doing and what we are requiring you to provide. And then we get down into a little summary of PPE, the different types of masks that are around and that you may already have been using when it comes to the dual filter cartridge type of mask, their limitations, the notes pertinent to COVID. We've put this together for your reference. Always, there's some disclaimers at the top. Our notes about gloves, work gloves, coveralls. Some people are wearing coveralls because sometimes for their side business, it's mandated. Some of the real estate associations and inspector associations are mandating that you come in coveralls, disposable, reusable, and how you treat that and how you deal with that. You're going to have a process for that. Then below this, we start getting into, I believe, some of the links. So lots of links to every province's official COVID-19 website, and then links to assist with developing company policies based on your province, and also like CNNEST for Quebec, WorkSafe for various provinces. Also extra helpful links, like the links to the different radon laboratories, financial links to the various programs. We've had these up on our website for a while. And then finally some links specifically for employers, that type of thing. So if you walk through these, you'll see all the same types of messaging. We've been looking at these links and at the resources that the provinces and different regions have provided.